come to her, 2-3 weeks later, it might not have been repairable. The degree of what was happening. So, do you find that that's a common issue, like
Of a misdiagnosis?
a misdiagnosis? Yeah.
Yes.
Well, I've had a
Did
few
you
of
want me
them.
to elaborate on that?
No. Well, why is it? Is it just laziness, or is it uh just not understanding these specific injuries?
So, what in Ontario, anyway?
Yeah.
What is our first line of support in these cases?
I'm
It's a
guessing family OHIP
family doctor,
Yeah.
right? So again, not any of your listeners. I'm not putting anybody down, any kind of profession down. We all have our specialties,
Yeah.
right? So the issue is that is our first line of offense. Not the average person can't phone up a sports medicine doctor or hasn't had a surgery within the past year that they can phone up a surgeon and ask them to look at them, right?
Yeah.
If you don't have good family friends that are such and such and such and such that can get you in wherever, right? Like that's few and far between. So you've got someone who is, I'll call it a master of all, even though sometimes they aren't masters of all, right?
Yeah.
So I've had several patients whose physicians won't even send them for a diagnostic test.
Jesus, that's ridiculous.
They cite radiation issues, even though we all have cell phones connected to our bodies on almost 24/7.
Literally having microwaves go through our brain
right?
on a daily basis.
Yeah. So that's the first problem. The second problem is just not identifying that it's anything, that there's actually a problem.
Yeah.
Thirdly, the ones that just sort of blanket send you to therapy, there's not an understanding of what's good therapy and what's bad therapy.
Yeah.
Right?
That was what I was going to ask you.
So you can be sent to Joe Blow therapist on how many therapy clinics are there as you drive down?
There's thousands.
Right?
Yeah.
That doesn't mean that there's a decent person in there.
Yeah.
Every single place that knows what they're talking about.
Yeah.
The thing that gets me the most, by far my biggest frustration, is as a therapist, because we have lots of knowledge, we should be able to fix people.
Yeah.
Regardless of what schooling you've had. Whether you're a chiropractor, a physio, a massage therapist, an athletic therapist, you should have enough schooling, education, whatever you want to call it, experience, right? Like if you've been doing it for 5 years plus, you should have enough experience to know when you can't help somebody anymore.
Yeah.
So I've had patients, this was earlier on in my career, where people had been going someplace for 6 months to a year.
Yeah. Well,
without any results.
I know that.
What are you doing?
I know that all too well from clients, for one. I find it funny because I'm not a medical expert or a therapist or anything like that, but because I've fucked myself up so many times, and I mean, I'm thankful for it because now it gives me another range of specialty to help people with. But I have clients and just regular people who have hurt themselves. They've been going to therapy or physical therapy or chiropractors, you name it, for months and months and months, and they're still dealing with that pain. They talk to me. I give them like 3 exercises. I'm like, just do these 3 things for like the next 5 weeks and shut up and tell me what happens later. And then the next time I see them, dude, that healed me. I'm not saying I'm a physical therapist or whatever, but it's experience and paying attention to the details of these. And one of the things
clip, please head on over to the link below to my YouTube page and watch the rest of the podcast. If not, you can always find me on Spotify or Apple or Google Play or all of those. We're on everything. Download, listen in your car, get it going. Thank you for the support. Please like, share, and subscribe. Have a great day.